How's everybody doing today? We're going to get started here in just a moment. We're going to give people time to go ahead and join, and uh, and then we'll get started here in about another minute or two. Right. Well, I'd like to welcome everybody to today's Brohawk Solutions webinar. And today we are featuring Yossi Abraham, the CEO and president of Zappix. And Yossi holds over 20 years of experience in global leadership roles in the high-tech industry. His company Zappix focuses on improving customer experience using innovative AI-based visual self-service solutions and transforming patient experience using its digital patient engagement solution. And with that, I'm going to go ahead and introduce Yossi of Zappix.
Thank you very much, Mark. It's a pleasure to be here with you.
Pleasure is all ours. Hey, Yossi, just before we really get started here, a couple of housekeeping items. The chat is open, so if anybody has questions, you can either put them in the chat or into the Q&A section down at the bottom of your screen. We're going to run for about 40 minutes or so, and there will be time for questions and answers at the end. And with that, Yossi, you ready to get started?
I'm always ready. Thank you.
Excellent.
So first of all, I have to say that I'm very passionate about CX. And throughout my entire career, I always loved the concept of customer experience and trying to improve it. And throughout all of my career, and even from high school, I always loved the technology. And what we'll talk about today is really about the interlock between customer experience, technology, with the real focus on healthcare. So let me start. The main agenda, or the four topics that we'll speak about today are, we'll zoom out and we'll start from how we see the market and major paradigm shifts in the market. Then we'll speak about how we see the healthcare industry today, and we call this trend the consumerization of healthcare. Very short discussion about the 4 P's of patient experience, and then I'll provide a case study of how we implemented some elements of that patient engagement and try to wrap everything together. Feel free to ask me questions throughout the webinar, and if there aren't any, I will start now. So as I said, we'll start with looking at the market, and we'll review several major shifts and changes in the market that we have seen over the last 10, 15 years. We'll start with the first one, which is the shift from voice to visual. And the way I see it, at least, it all started in 2007 with the launch of the iPhone. We all became visual creatures. And this shift also had several other shifts, like the move from analog to digital, the move from voice to visual. And it was led both by technology that enabled it, but also by consumer demands for this. The second major shift is the move from stationary to mobility. We're all on the move now. And even throughout the 2 years that we were all stuck at homes through the COVID pandemic, we still had to be mobile. We had to move from office environment to be able to work from home. We all had, all of us that had kids working on laptops in different rooms of the house. And then when we were able to start to go out, we really were eager to go to some Starbucks and work from there and so on. So as people now, we are on the go, and it's almost becoming to a place that we're a bit too addicted to our phones. And think about the last time you went to a restaurant and you saw 4 family members, all of them looking at the screen and not talking to each other. But as a market, we're moving from stationary to mobility. The third mega trend that we see is automation. AI, RPA, ML, machine learning, NLP, all of this alphabet soup of acronyms are really all about automating. And as businesses, enterprises, healthcare providers, you need to choose the right processes to automate, and the ones that make the best sense for you guys. The fourth mega trend that we see are open interfaces, a move from siloed data and proprietary systems to open interfaces and APIs. The modern use of APIs really sparked a totally new way of communicating between different systems and enabled an era of sharing and interconnected world. Many say that it started around the year 2000 when Salesforce released what is considered the first modern API. And what it allows is to add more and more complementary services versus the need or the actual forklift upgrade replacements that were there in the past. I started my career 25 years ago, and I remember our first systems in my previous company were all proprietary hardware, proprietary software. No one could almost integrate almost nothing to it. And if you look at the differences today, where everything is interconnected, it's a huge shift in the market. And the last major shift that we see is the move from on-prem to cloud-based solution. AWS, Azure, Google Cloud, and others together, coupled with major network advancements in networking over the last 10-15 years have allowed this move. We, for example, are on AWS. We have no server on-prem. We have a totally distributed R&D and R&D team, and this really allows us to implement things quickly and to launch updates all in the cloud. It's from interoperability, maintainability, even up to certain things around reliability. All of that has improved dramatically over the last 10-15 years for cloud solutions. So these are like 5 mega trends that we see in the market. But when we look at the landscape of businesses and enterprises, we feel that they are still suffering from what we call the weight of legacy. And many of those enterprises are failing or lagging in making that digital transformation, that digital transition. And there are different reasons for it. It can be because of their cumbersome IT that is built on layers and layers and layers of disparate systems, that every change there is painful and costly and slow. It can also be just because projects are slow and IT and technology is too slow to adapt to the business needs. Sometimes it's also about trying to do too much with automation and trying to boil the ocean and not take it in a phased approach. And the last thing is that there's so much data now. Just in the last 2 years, 90% of world's data was created, and it's becoming exponential as we go ahead in the future. So we spoke about the market. This is what we see as enterprises. And then from a consumer point of view, there is a demand for change. There is a demand for digitization, demand for on-demand economy, the adoption of mobile phone, subscription-based models. Think about all of us with Netflix and Hulu and different types of subscriptions, or Uber on-demand economy, Airbnb on-demand economy. We're used to it. That's what we want as consumers. So when we take all of this, market, enterprise, consumers, and try to think about how does that impact the healthcare, This is where we see the convergence of what we frame as the consumerization of patient engagement. And this is really the convergence of healthcare and technology. We recently published an ebook that is about this topic, where we detail the different elements that are part of this, and to help our customers and partners in the healthcare really support them in this digital transformation. And in the next 5 to 10 minutes, I'll describe some of those elements. So the main 5 elements that will guide us through the process are, as you can see here, treating patients as consumers, planning the patient journey, prioritizing touch points, using a phased approach, and continuous improvement. Some of them are practical tools, as you'll see in a second, and some of them are more of a mindset focus and mindset change. We'll start with the first one, treating patients as consumers. This is a mindset change, and it's really looking at treating the patients from changing from a transactional, looking at them as transactional interactions to long-term investment. When people today compare, when they go to the healthcare provider, they compare the experience they have there with other experiences they have had in other places. We also look at it as we know the term CLV, customer lifetime value, but we are telling our healthcare customers, you need to start to have the term PLV, patient lifetime value. And this, when you look at your patient as consumers, that will start to have that mindset of a change. I love this slide because it really shows when you're talking with healthcare providers, they typically see their competitors as the hospital at the other side of the town or the city, a different practice that provides similar services, whether it's derma or something else. But what the patients are comparing the healthcare provider with is not the last experience they had in the healthcare, but they are comparing them to the best experience they have from the top brands in the world, whether it's an experience that they had from Zappix or from Marriott or from Chick-fil-A or whatever they consider the best experiences they had, that's what you're always compared with. And experiences matter for a long run. A friend of mine recently had to go to an ER, and they had to wait. Him and his wife had to wait for over 5 hours to be admitted, and then they waited another 2 hours for the first test, and then another hour and a half for the second test. And it was such an frustrating and agonizing experience for them. And he told me he will never go back to that hospital again. And we have choices. We have, at least where I live in the Massachusetts area, we have probably 5 to 6 hospitals in a 15-mile range. We have choices. And now when we talked about PLV, patient lifetime value, and so on, you can understand the critical importance of that. Another element for that is our reviews, for example, on specific doctors, on Google reviews or insurance websites and so on. They are becoming more and more important when you are looking for an orthodontist or a dentist and so on. People look at reviews today. So that's critically important to start to look at your patients as consumers. The second element of the consumerization of healthcare is planning the patient journey. It's really to map out the entire journey that you foresee for your patients from the moment they book their appointment until they complete all of the post-discharge procedures. Lay out all the relevant touch points. And it's not only the medical touch points, it can be the scheduling, it can be the intake, everything there, and consider what can we do to improve them. And examples can be providing better patient education, at the tip of their that they can access it whenever they want. Another example can be sending visual reminders versus just bland reminders that you have an appointment to do tomorrow at 10:30 with no address, no location, etc. But if you do it in a nice visual digital manner, you provide all the relevant information for them. So that's an example of a touch point you can relatively easily improve. When you have all of that list of touch points, you need to start to prioritize. Okay, what do we do now? And this is a practical tool to prioritize. And we call it the matrix of evolutionary automation. And on one grid, you see there low volume, high volume, and the horizontal one, the high empathy, vertical one, high empathy and low empathy. And what our recommendation always is, plot all of them, plot all of those touch points, whether they are high value, low value, do they require low empathy, and start with the ones that are higher volume, do not require a lot of empathy. For example, scheduling, for example, certain follow-ups, and etc. So, and it will depend on your touch points there. And then you automate, you start the digitization process with these ones. I'm a true believer of the 80-20 rule, the Pareto principle. And I also believe that doctors should remain doctors and nurses should remain nurses. We don't need nurses to, for example, pick up the phone and call the day after an appointment to check the status of the patient. We can use technology to assist them doing that. Technology should not replace the human touch, but it should complement it, and it should make every patient experience a simpler, faster, and easier experience for them. So when we are prioritizing all of that, we need to also remember there are those touch points that will still require the human touch, and we are all for it as a technology company. Then the fourth element is the phased approach. Many projects fail because organizations try too much, too quickly, and all at once. Most of my career I've had in project management. I was head of PMO at some point, and I've seen that so many times that projects fail because of trying to really, I love the term to boil the ocean, but we're trying to boil the ocean with too many changes at the same time. Don't do that. Use a planned approach, a phased approach based on the prioritization we discussed. And examples of certain use cases or touch points that can have immediate impact with minimal investment are listed here. I spoke about visual appointment reminders, referral programs. How can we reach out with technology to remind people that they have a referral but they haven't booked an appointment, and that can, of course, improve the outcomes of patients' healthcare and reduce leakage for that specific provider. Or sending the right pre and post procedure instructions before certain procedures, like certain surgeries or colonoscopies and so on. And these are all very high intensity touch points, but do not require an overhaul of all of your systems. And that's where we recommend that phased approach. And the last element is back again to a mindset change. So we started with a mindset change, then there are three practical tools, and then a mindset change again to complete it. And it is all about continuous improvement. When we're talking about phased approach, you have to be in a mindset also of continuous improvement, because you're not going to do everything at one time. Keep examining, keep fine-tuning, keep questioning, keep improving, use data, use analytics, and very important, you need to choose partners that can be flexible when changes are needed. We, for example, use our studio, which is a low-code, no-code service creation environment, And for us to make changes is very, very fast, and we can make changes in seconds to hours to our current technology that we provide to our customers. And the main reason we have done it is to allow this continuous improvement for our customers. Receive inputs, use digital surveys, use intake forms, receive inputs from patients, and very important also from staff, because they are the ones that will tell you a lot of times where efficiencies can be derived. So to summarize this section, so we talked about the 5 elements, 2 mindsets at the beginning, at the end, and 3 practical tools that if you implement them properly, then you can really start the digitization and provide better digital patient experience. While you're doing all of that, I urge you to think about the 4 P's: proactive, personalized, predictive, and precise. So whenever in customer experience, proactive approach is always, it's hard because you need to think ahead, but this is where the planning, when you map out that user journey and you say, okay, that use case in the future, so how can we send the right information to the right person, for example? How can you be proactive in the communication, in the engagement? That's a mindset that you need to have there. Personalization, we are all used to it from different vendors today, that they really provide us with a personalized experience based on previous purchases, based on previous services that we chose, etc. And even just by adding the name, hi Yossi, to a certain text message or an email, that's a small step towards this personalized experience that that we can provide to our patients and customers and so on. Predictive is hard. Predictive is something that we need to start to think about. Okay, if someone comes with this kind of symptoms or asking this kind of questions, can we provide them with that response, with that answer, with that treatment, and so on? But predictive, if you're using the right analytics, if you're using the right technology, that should help you with providing predictive experiences to for them. The last part is precise. Be precise with what you send or what you communicate or how you engage with your patients. And I'll give an example here. You can send, for example, for colonoscopy, as a prep for colonoscopy, you can send all the instructions, the 7, 5, 4, 3, 2, 1, in one piece of paper or in one email that you send your patients. But that's not precise. You're just telling them, you have the responsibility, you now need to make sure that you are following all of those instructions. As opposed to 7 days before, send them just the extract of what they need to do now. 5 days before, just the extract of what they need to do now, 5 days before prep. 2 days, 1 day, 1 day after. Orthopedics, for example, they need to do certain physical therapy, 2 days, 5 days, 7 days after a certain procedure. Send them that precise instructions, those precise instructions, precise information. And it also needs to be at the right time. So these are the 4 P's that we really recommend having them in your mind while you're planning all of that. And now I'll speak about how we took all of that and implemented our digital patient engagement solution that encompasses all of the previous things that we talked about. And this is a solution that we provide to our customers in healthcare, and we offer to partners in healthcare. And it has, at the core of it, we have the on-demand apps that I'll speak in a second, and multiple different services that are all about improving the patient's outcome in the healthcare that is provided to them. At the core of the solution are the on-demand apps. They are web apps, basically. They have all the advantages of a native app without its disadvantage. Like they're much cheaper to build, much faster to make updates. You can load them on any device. They're not attached only to the device you downloaded them at. You can access them through multiple different channels, whether it's emails, links on text messages, on the website, and QR codes, and so on. And they can be accessed on laptops, on computers, on desktops, on iPads, and et cetera, et cetera. So this is the core of our solution. This is where we put all the information that is required for those patients. And now I'll just very quickly go over the different services that we provide. The first one is visual appointment reminders, as opposed to just bland reminders that some of us are getting from, let's say, dentists and so on, or even I get it for dry cleaning pickup the day before. Our reminders have a link that brings them to the on-demand app, and then it opens up different options. For example, directions with a map, with where to park. If you need any intake form, that they can do it in advance, and so on. And all of that is in of course, fully automated solution integrated with the relevant EMR. The second component of our solution is patient education. As opposed to providing patients with hard copy, paper, brochures, and so on, we put all of that into our on-demand apps. Very easy to update. You don't need to print out now, thousands of brochures again if you need to make a change. Very easy to access them whenever you need them, and they're all in digital form. So if I forgot a certain package that I received from my doctor at home and I want to discuss it with a family member, I have everything on my phone now. I can just open it on the right page, and it will also all be there. So that's a very important part of providing digital patient engagement. Another element are the timely and precise pre and post procedure instructions. So this is an example, I think, of colonoscopy, where we send the relevant instructions, 7 days, 3 days, 2 days, etc. And it varies. It varies between the different procedures. So, and one of our customers has, I think, 6 or 7 different types of procedures. Each of them have 4 to 5 or 4 to 6 different types of preps. So it's like a matrix of about 40 to 50 different options. And each of those options has instructions 7 days, 3 days, 2 days, 5 days, 6 days. And it is like a 3D matrix of about 250 different options. And our algorithms, our technology knows to send to the right person, the right message at the right time in order to allow them to come prepared to that procedure. And since we launched it there, no-shows in the 24 to 48-hour window has reduced to almost zero. Reschedules have reduced to almost zero. Again, in that window, people are coming prepared to that procedure. And that's applicable also to any other procedures like surgeries or other ortho procedures, and etc. Another service that we thought about of helping is reminding patients that they have a referral, but also really emphasizing why is that referral important for them. So it's not just, oh, you have a referral, you haven't booked an appointment, but what is the importance of that procedure for your health? So again, using visual, using the concept of customer experience, of explaining the value of that outreach to them is very, very critical there. Again, fully automated workflow. What we are trying to do is to reduce the human touch and the human effort that is required in things that are relatively simple, but critically important. And the main benefits here are it is really improving patient care, while we reduce the leakage for that specific provider. And then continuous improvement, if you remember from one of those elements, in order to do continuous improvement, you need feedback. And this is where we presented our digital surveys. It can be the day after an appointment, but we proactively send that message to a patient. Thank you for coming yesterday. Would love to hear quick feedback about the procedure. And it can be a very quick one. It can be 1 to 2 questions with 5 stars. It can be longer feedback forms if it is required for certain procedures. But the important part here is to receive the voice of the patient, and then of course to act upon it. But this is the first step of it, is make it very easy for the patients to answer, and then after have that information accessible for the enterprise. And the last component is patient communication. It's the ability, we provide our customers the ability to send out patient communications. Remember again that they are used to having announcements, newsletters, updates from other verticals. And we believe that especially in departments that for chronic patients and so on, you want to keep that engagement. You want to send the recipe of the week. You want to send monthly newsletters, et cetera, et cetera. So we provide the tools for our customers to do that. One question that we receive a lot of times is, how do our patients are more on the older side, will they use it or not? So we ran a survey where we analyzed over 2,500 responses to post-appointment surveys, and we have seen that 32% of the responses came from people that were in the age of 61 to 70. 10% came from people that were over 70 years old. So 42% of the responses, and we analyzed over 2,500 surveys. So 42% of the responses came from people that were at the age of 60 and above. 68% came from people that were 50 and above. I really believe that proves that people at all ages today are using digital devices, digital platforms, especially after the COVID pandemic, where you couldn't book an appointment for vaccination or a test without using at least a website, if not mobile apps and so on. Everybody's using it today. You cannot go to a restaurant in many cases, in many places, and you have to scan a QR code to see the menu. So people are used to digital devices these days, and it will only accelerate and expand as the population ages. We do see some drop over 80 years old. So those 75 years old people today, in 5 years will be the 80, and they will continue to use digital devices. So to summarize, we believe that there are many benefits for digital and modern patient care. And some of the main benefits are really to improve, first and foremost, to improve the quality of care. And while you do that, you also improve the patient satisfaction and loyalty. Loyalty is a critical element here. And therefore, you improve the financial outcomes for your healthcare institution and improve the competitiveness of and positioning of your of the healthcare provider. If you'd like to learn more, or if you'd like to download our ebook about the consumerization of patient engagement, you can scan the QR code that you have here on the bottom right. If you want to learn more about us, you can scan the QR code on the top, and I'll be happy to answer any question.
Yossi, thank you very much. I mean, this is very enlightening about the work that Zappix and your organization has been doing in this field of really helping providers improve their patient experience. A couple of questions I had for you, though. When it comes to the customer journey, I think you did a really great job of defining how that patient journey migrates, and where are you seeing organizations getting stuck as they try to identify and document what the existing patient journey is versus what the hoped for patient journey would be?
It's a great question because we see many organizations get stuck, and I think they know how to map it, but their biggest challenge is how do I move from where I am today to that future state? And I think that I mentioned the weight of legacy at the beginning of this, and they are always thinking, oh, but if I'll make this change, I need to work with IT, and that will take me 3 months. And every time I need a change, and I think that this is really one area that is hampering the progress. The second thing is that sometimes people are just stuck in the way they've done things, and people that are doing the same procedure or process for the last 10, 15 years, they need to open up. They need to open up and think, okay, how is it done in other places? And that's why I love that slide about the competition that is not actually coming from healthcare. Because if they, many times when I go and on weekends and I don't know, I go to a mall, I go to somewhere, I always try to connect it. What did I see here, and how can I implement that in my technology company? And I think that's something that sometimes is missing in that aspect.
Great feedback there. One of the things that you also brought up was the need to be, as part of your 4Ps, to get that max PX. Being predictive and precise is such an integral part of that max PX formula. When organizations are looking at their patient journey, are you seeing journey failures when providers are not being specific enough with their patients?
I'll give you a very simple a personal example, or not personal, but someone from our office that had a colonoscopy, and it was on a Monday, and then on a Friday before, we were in the office here and we talked, and he said, yeah, I have my colonoscopy on Monday, and me and the CTO here asked him, and now we became experts on colonoscopy because we provide this service. We asked him, okay, did you start the low fiber diet and all of that? Said, oh shoot, I totally forgot. I need to do prep. And this is where, I think this is a great example of, he did receive a letter, in the mail 3 months before. These are the instructions, but no one followed up on that. They didn't give that person the precise instructions at the right time of what they need to do. He had to call in and reschedule the appointment. And when you reschedule a colonoscopy, they cannot book anybody else at that time because you need the 7 days prep. So they lost at that time a procedure that probably they received from insurance somewhere between $2,000 to $4,000. So that's a great example, I think, of not sending the right information at the right time to the patients.
Yeah. One of the things, and I think you and I have spoken about this, previously, is so much of the patient experience is driven from the agent experience, or the folks that are working with the data and getting the customer or the patient comfortable, either in an office setting or wherever. If from a contact center perspective, how important could having improving that agent experience, so that the information that's being sent out or being provided, any questions that could be potentially answered, via phone call, can also be put there for agents at the click of a button, and making sure that there's synergy between what the agent's seeing and what the patient is seeing as well, through the on-demand app. Is there a play for patient contact centers in that regard?
So there is, and I'll divide my answer to two sections. One area that you can help agents is reduce the number of calls that they're receiving for boring, mundane, repetitive calls that really should not be answered by agents. And in the healthcare, it can be the need to people call in to schedule an appointment. And it's time consuming for the person and for the agents, and you don't really need an agent, a qualified agent to book an appointment. So that's a great example in the healthcare side, that if you reduce this number of calls, you improve the quality of work for the agents. And the second part is, what tools can you give the agents that can optimize that interaction with the person while they're on the phone? We do it today with what we call Agent Assist tool. That is, it's a console that allows the agents to quickly send a message, text, or email to the person while they're on the phone in predefined templates of links to specific pages on the on-demand apps that we pre-built. And it can be, for example, to complete an intake form. So instead of the agent typing in, what is your name, Yossi? Where are you from? How do you spell that? And so on. Oh, can I just send you a link to the form? Boom, that goes there, and it's being pushed immediately to the EMR. Another example, to complete payments if needed. Can I send you the link to complete payments? So there are tools that can help the agents optimize that interaction and avoid unnecessary, boring, repetitive actions there. I hope I answered it.
No, I love that. I mean, the more you can, from a patient perspective, if I call in and someone says, "Hey, let me go ahead and make your experience a little bit easier for you. Let me shoot you this on-demand app or on-demand text. You can go ahead and complete all of your paperwork, et cetera, et cetera." I'm like, okay, that to me, that means that my time is as valuable for that person as it is to me. And I may not have 30 minutes to go through an entire intake form on the phone, because I got kids or dogs or just life happening. And the ability to be that flexible and put that flexibility in the hands of the agent is I think is mission critical.
And
as well.
One of the things that we're approaching healthcare for healthcare, but because we have a lot of experience from non-healthcare, so we support some of the top brands in retail and e-commerce as part of our visual self-service solutions in the non-healthcare. And a lot of the best practices we see in the non-healthcare, we bring into the healthcare. And I think that's one of the reasons that we are, our way of thinking is a bit different than others. We are really bringing that consumerization, best experience of consumerization in CX into the PX, into the patient experience. And we lost Mark. Any other questions from other people, other participants? Oh, here's Mark again. We lost you there for a second.
Hey, sorry about that. Hopefully you were able to go ahead and continue.
I did.
Excellent. Well, fantastic. Well, Yossi, I just want to go ahead and take this time to thank you for being a guest on this webinar. Great information, and we're going to go ahead and publish this out so others that were not able to attend are going to be able to access this information. I think it's so valuable for those that are in the healthcare space.
Thank you so much for having me.
All right, Yossi, if anybody needs to would like to get a hold of Yossi to talk about the Zappix solution, whether you're in the healthcare space or any other space, feel free. His contact information is here. Yossi.abraham@zappix.com. I guarantee if you call or text him, he will answer. He will respond. And Yossi's just one of these guys that's just so passionate about this industry and the work that his company does. It's not a job; it's a passion for him. And so you definitely reach out and um, you know explore, get a demo. See what the platform is all about. And if you'd like to go ahead and talk to me personally, about this, I'd be more than happy to go ahead and set up a demo with Yossi and team as well. I can definitely provide you some additional feedback as far as some of the features and functionalities that the platform offers. And with that, Yossi, thank you very much.
Thank you so much.
And I hope you have a great rest of today.
Same here. Thank you, everybody.
All right.